this episode, I'm going to be talking about how learning about trauma and adverse childhood experiences helped me as a physician and also as a human being. The ACE awareness and its implications did not just add a tool to my kit, it fundamentally changed or reoriented how I see people. As a clinician, the reading of the symptoms shifted from what's wrong with you to what happened to you. A patient's aggression, non-compliance, missed appointments, or substance abuse stops looking like a personality or motivation failure and starts looking more like a nervous system doing what it has learned to do. The reframing changed my clinical hypothesis before I even open my mouth, and patients feel that difference immediately. You begin asking about history before labeling a behavior. A borderline personality diagnosis looks very different when you know it sits on a foundation of chronic early relationship trauma or childhood abuse. The assessment becomes more complete. Routine screening for ACEs using the 10-item ACE questionnaire or validated tools like the CTQ surfaces information that changes the treatment planning. Knowing a patient has an ACE score of 6 tells you that their presenting depression may have a deep biological substrate, the HPA dysregulation, the blunted reward circuitry, not just a cognitive distortion amenable to brief CBT. It also tells you the therapeutic relationship itself will be a central mechanism of change and not just a vehicle for delivering techniques. Your therapeutic relationship with your patient improves. Patients with high ACE histories have nervous systems calibrated to detect threat in relationships, including the physician. Understanding this means you don't take ruptures personally. You don't mistake wariness to hostility, and you don't interpret non-disclosure as resistance. You learn to slow down, be predictable, name what you're doing before you do it, and repair that rupture or broken trust explicitly. Because for many of our patients, an adult reliably repairing a rupture will be a genuinely novel experience for them. The therapeutic relationship is not just for building rapport. It's also for attachment, disrupted patients. It is their primary vehicle of the neurological change. You work with the body, not just the mind. ACEs are stored somatically. I didn't know this. I learned, and it was mind-boggling. The body keeps score. Chronic pain, autoimmune conditions, GI disorders, and fatigue in the patients may have ACE-related allostatic load at their root. This means you ask about bodily sensations, notice the posture, the breathing, the somatic or trauma-informed approaches rather than purely cognitive ones. It also means you don't pathologize the physical symptoms without taking the trauma history seriously. You understand why evidence-based treatments sometimes don't work for these patients. A patient with high ACE scores who fails multiple antidepressant trials, drops out of CBT, and cannot complete exposure therapy is not treatment resistance by character. Is the nervous system too dysregulated to access higher-order cognitive processing? Stabilization, window of tolerances work, and that should precede trauma processing. Trying to do EMDR on someone in chronic survival mode is like trying to remodel a house while it's still on fire. This saves us from frustration and saves a patient from another experience of failing at treatment. It stops the progression of trauma. Then the intergeneration transmission also becomes visible. ACEs transmit from generation to generation if it's left untreated. The dysregulated infant, through measurement, emotional unavailability, and frightening behavior, will transmit this to a child. A child's behavioral problems should be seen through the lens pointing towards the parent as much as the child. Working with parents' ACE history may be the most upstream intervention available. We avoid secondary traumatization with more awareness. Clinicians working with high ACE population absorb vicarious trauma. Understanding the mechanism that you too have a nervous system that responds to sustained exposure to other suffering helps you recognize compassion fatigue early also. It removes the implicit shame of being affected. Your nervous system is doing what nervous systems do, not failing at professionalism as a human. Now, coming to how learning about ACE changed me as a human is how fundamentally different explanatory framework I can use now for people I thought were difficult. The person in your life who is chronically explosive, angry, avoidant, self-sabotaging, or impossible to get close to is carrying a nervous system shaped by experiences you likely can't see. This doesn't mean tolerating harmful behavior. It also means that our first internal move becomes curiosity rather than judgment. The question shifts from why are they like this to what must have happened for someone to become like this. The compassion becomes less effortful and more structural. Empathy as an emotional act is exhausting and sometimes depleted. Understanding ACE builds that is more durable. A cognitive framework that generates compassion automatically because you understand the mechanism. It's the difference between forcing yourself to feel sorry for someone and simply understanding why they are the way they are. The compassion follows naturally from the understanding. You reflect on your own history as well, more honestly. Nearly everyone carries some ACE exposure. The question is always the degree and the protective factors present. Understanding the mechanisms invites you to look at your own patterns with more curiosity and less shame. Your own hypervigilance, avoidance, difficulty with intimacy, perfectionism, procrastination, or people-pleasing all become legible, not as flaws, but as adaptations. This self-knowledge makes you a safer person for others because regulated clinicians and regulated humans are the most powerful intervention there is. You become slower to judge. You become slow to judge parenting, poverty, and addiction. ACE research makes it structurally impossible to look at addiction as a moral failure, abusive parenting as pure cruelty, or poverty as laziness. The biology makes the connections very clear. A parent who screams at a child was almost certainly screamed at. The behavior is transmitted, not invented. This does not remove accountability, but it relocates the intervention target from punishment to healing. The repair becomes more important to you than being right. Relationships with high ACE individuals teach you that consistency, predictability, and repair are more healing than any single moment of connection. You stop needing every conversation to resolve perfectly because you understand that what builds trust is showing up again, and again. This makes you better at every relationship, whether it's clinical, personal, or in families. You hold suffering with more gravity and less pity. Pity puts distance between you and the suffering of the other person. It implies that they are categorically different from you. Understanding ACE collapses that distance. The difference between you and a person with a high ACE score is often the presence of one protective adult in childhood, a roll of the developmental dice. What you develop instead is solidarity and not how sad for them. You change from how sad to how extraordinary is it that they're still here. The deepest shift ACE literacy produced in me is that you stop experiencing difficult people as obstacles and start experiencing them as information. Every behavior makes sense in context. Hurt people hurt other people. And my job as a clinician and a human being is to find that context. I hope this was helpful. This was very eye-opening for me, and I'm hoping to educate more people about ACE and adverse childhood experiences and how they shape us as adults. Thank you. All right.